Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to tonight's edition where I'm going to be covering a topic and share some information with you, and then we're going to spend the bulk of our time taking your questions. So I want to encourage you, if you do have a question about Medicare or Social Security, you can actually begin to put those questions in the chat. And as a reminder, those of you that have been a part of this know that this is very important. Sometimes people try to be so condensed to make it simple, but I can't understand your questions. So I appreciate you being brief, but don't be so brief where I cannot make heads or tails of really what you're trying to ask. So if you want help, make sure your question is very clear. A couple things, our office is open. Sometimes we have people that need immediate assistance. We are Medicare brokers. Be delighted to help anyone that has a need. We are actually write business in all 50 states as well as DC, so we can help you really anywhere that you live. And so you can call in. There's an 833 number there you'll see on the screen. We're Central Time, located right outside of Kansas City, Missouri, in a suburb called Overland Park, Kansas. And so if you call in up till 7 p.m. tonight, you can actually get someone live. Just tell our switchboard operator your question, and they'll direct you to the right personnel. So we'd be delighted to assist if you do need some additional assistance. One more thing, if you are not yet a subscriber to our YouTube channel, we have a YouTube channel that we put a lot of time into and love doing it. In fact, I prepped for a video today that I'll shoot next week, but there's over 400 videos about Social Security and Medicare, really anything that you need to know and understand before you start making decisions about either one of those programs. You can find help on our YouTube channel. And then for those of you that know you're ready to start Medicare and you're still a little bit confused, I would encourage you, go to our website, MedicareSchool.com, and we have what we call the Essentials Workshop. Every year I shoot a new one because Medicare makes changes, but it's a 50-minute workshop on the ins and outs of Medicare, the kind of the do's, the don'ts, and really everything that you would need to know to really understand Medicare well before you start making decisions. We start our relationship with our clients with education. That would be YouTube channel, our Facebook group as well, and then of course tonight's event. And then our website as well. So truly, folks, there's plenty of information out there that will be reliable. It'll be accurate. It's not biased in any way. We are brokers. We write all kinds of plans, and so we really can approach the subject very neutrally so that we can give you great advice. And so get an education. Give us a call. We love to serve as your Medicare broker. And then remember this, and I'll get started. There's no cost to use someone as your agent, whether that's us or anyone else. The insurance company, they pay us, not you. So our services are truly free to you. And as you know, I've been in this business 16 years, so the services that we provide are beyond the norm. I can assure you that. We really dig deep. We help people enroll into Medicare A and B. We'll help you with Social Security questions. We'll help you enroll into Social Security if you want to tie your Medicare in with that at the same time. All of our agents know how to do that. We help people that are high income to appeal IRMAs when they have those IRMA surcharges. So the point is really anything you need from A to Z, we can help you and serve as your Medicare broker at zero cost to you because, again, we're paid by the insurance companies, not you. All right, enough of that. Let's get started this evening. I got just a very simple, quick topic tonight. Very important, though, because we're going to talk about 5 surprising things that Medicare will actually cover in 2025. Sometimes people may not be aware of these specific items, so we've selected this topic, and I hope that it will be helpful. And then if you have further questions even about this as we get into the Q&A time here in just a couple minutes, please put those in the chat. So number one, I'll start off with just talking about mental health services. We all know the issue and the importance of dealing with mental health issues when those are present within people. It could be anxiety, it could be depression, it could be schizophrenia. And so Medicare, really this last couple of years has gotten real serious about doing all they can to help people with the mental health issues. And so Medicare will help you as far as diagnosis as well as treatment, and then also medications. And so when you think about mental health, number one, Medicare actually, under the Part A of Medicare will cover 190 days in a mental health institution. That's 190 days in someone's lifetime. And then a tremendous amount of service on the outpatient side, as you can see, psychologists, psychiatrists, doctors that specialize in mental health. As long as they take Medicare, is the Part B of Medicare that's going to cover that. So A covers the mental health inpatient, B, a variety of mental health that we would receive on an outpatient basis. And then if you're enrolled in a Part D plan, which you really should be once you're on Medicare, there are a lot of medications, again, that we covered by the Part D plan. I'm not saying all of them are going to be, but many of them are. Some of the most common ones right now would be Prozac. It's covered in generic form for sure. Lexapro, Zoloft, Xanax, all these things that people are taking for their mental health conditions will be covered by Medicare A, B, or the Part D plan. All right, so that's one item. Let's talk about the second one, and that would be the real problem right now with opioid use disorders. There's, really an epidemic in our country for people that have been affected by opioid addiction, and so Medicare really has taken a very significant stance to try to help people who may be affected by opioid disorders. And so what they're doing, first off, is want to make sure that they get people into treatment. And so once there's been a Medicare diagnosis of this disorder, then they want to get you into some kind of a treatment program. And that treatment program, of course, will include ongoing accountability through drug testing, also individual therapy as well as group therapy, and then also just education about overdose. To make sure that folks are not only diagnosed with it, but also are getting sufficient treatment. So if you or someone you know has that disorder and they're on Medicare, please reach out to Medicare physicians, Medicare providers, and get enrolled in one of those kind of a treatment program. All right, that's number two. Number three, let's talk about diabetes. Of course, many of you know diabetes is really called the silent killer because many people have it that don't know it. They say right now that 100 million people are pre-diabetic, meaning their blood sugar is at a place where they're not yet diabetics, but they're pre-diabetic. And so we have to take diabetes very serious. So if you're just pre-diabetic, then you want to make sure that you understand that the chances of actually becoming a full-blown diabetic, whether it's type 1 or type 2, is about 1 out of 4. And so if you're pre-diabetic, you need to really try to get hold of that and do things with diet and exercise. But if you do become diabetic and you're actually diagnosed with that, then there's a tremendous amount of support provided by Medicare. And of course, that begins with just diabetic management. Because if we have the disease, we have to certainly know how to manage that disease. And so most people that are new to this disease are not sure exactly all they should be doing. So Medicare has put together really support for people on Medicare with diabetes, and they'll do training, actually 1 hour of individual training, and there's 9 hours of group training that Medicare will also cover. And then you're able to actually get follow-up training they'll cover for 2 hours every single year. Again, they want to help you to manage your diabetes and cope with that condition. And the whole emphasis of the training that Medicare is going to cover, number one, is really to help you to improve your physical activity. Because if we do that, then a lot of people can get control of that diabetes, to help you develop healthy eating habits, to make sure you know how to check your blood glucose levels, and then you stay on top of that. And then that you're taking the medications that you need to be able to manage that disease, because the whole goal is to reduce the risk of your diabetes worsening. Okay, why? Because if we don't get control of that, it's going to have an effect, of course, on the health of your blood, which then the right amount of sugar is not getting to your organs, and that's going to cause all kinds of problems, from health, heart issues, and a variety of health risks that we put ourselves in if we do not manage diabetes. So Medicare will help pay for some of those expenses. And then number four would be home health care. Home health care. Now, I think most of you that are watching this tonight, if you've been looking at Medicare, you realize that Medicare does not cover custodial services in a long-term care facility. Meaning in a nursing home, a long-term care facility where someone may be because they need assistance with what we call activities of daily living, meaning someone needs assistance with bathing or dressing or eating or transferring from the wheelchair to the bed or the wheelchair to the toilet, or they can't take their own medications because they have dementia or Alzheimer's. So those kinds of things are called custodial, and they are not covered by Medicare unless they're necessary to treat those in conjunction with some other medical issue. So if I had a stroke, and I'm certainly going to be able to go through rehab to recover from the stroke, so Medicare would be covering my activities of daily living. But once I've got to a place where they believe I've improved, then I'm going to be on my own with my activities of daily living. Okay, so that's just the way it works with these custodial needs in a long-term care facility. But when it comes to home health care, there are support services that could be covered by people that are homebound with some type of an illness or some type of an injury. Again, they're homebound, not in a facility, but homebound. And it's possible that Medicare A and B may cover some of the services they need, which include speech therapy, home health aid services, medical social services, medical supplies. All right. Now, here's what I want you to know about this home health care services. Medicare doesn't automatically cover everyone in their particular program, which means there's certain criteria that you have to meet to be able to qualify for this home health care coverage. Meaning you have to have a professional that actually diagnoses you and that says that you have this need, and they have to certify that you are homebound, and they have to prove that you need specific services for the treatment of your medical conditions. And so if you qualify and this healthcare professional certifies that, then Medicare may be able to pay for some of your healthcare services at home. Okay, so you got to go through that process. I know there's some hoops to jump through, but most people want to stay home anyway. So if you're homebound, there may be some additional services that Medicare will cover. All right, and then number 5, and sometimes this is kind of a shocker for people, and that is acupuncture. Now, I want to talk about acupuncture, but just before I do, I want to tell everyone that it's important to also understand how Medicare covers chiropractic care, because I know there's a lot of chiropractors that also do acupuncture. Not all do, but some do. But when it comes to chiropractic care, Medicare only covers the adjustment of the spine, and that's it. So if you go to a chiropractor, number one, that takes Medicare, the only thing Medicare will cover is that adjustment of the spine. So if that chiropractor does x-rays, they're not covered. Some kind of maybe a traction therapy, that's not covered. Maybe a heat therapy or some other kind of a therapy that the chiropractor is administering to you is not covered other than the adjustment of the spine. Okay, so the exception to that rule would be then acupuncture. And there's some rules with this. And so here's what happens. Medicare will cover acupuncture for chronic lower back pain. And you certainly have to meet certain requirements. And so if you do, and you're going to a Medicare provider that does acupuncture, you actually qualify for 12 acupuncture sessions in 90 days. Now, if you're improving after those 12 sessions, they'll cover an additional 8 sessions. So you can get 20 sessions in a 12-month period if indeed you are showing improvement to this lower back pain. Now, if your condition worsens, it's not getting better, then Medicare is not going to cover those additional 8 sessions. And so here's what you got to know. If you want Medicare to cover acupuncture, it has to be administered by a licensed healthcare professional, meaning it has to be a doctor or a nurse practitioner. And this practitioner must have received education. There's some education requirements from a school that is accredited by the Accreditation Commission for Acupuncture and Herbal Medicine. So just because they know how to do acupuncture doesn't necessarily mean Medicare is going to cover it. So be careful. Just like with chiropractors, you have to make sure that it's someone that is truly certified, and that you can get those. And by the way, my wife has been helped immensely by acupuncture, so I know it's very effective, and we're very glad that Medicare will cover that as well. All right, so those are the 5 services. And again, if you have other questions, you can ask me about those as we get into our Q&A time. All right, so Daniel is our producer. He's with me tonight. We're in our home office, and he's going to feed me the questions, and again, make sure I can understand them. And Daniel, I am ready, sir. All right, Doug. If a person decides to continue working past 65, also stays in the group health plan, but also signs up for Medicare A and B, how will that work out? Which plan will be the primary payer? Okay, Doug, great question. So here's the way it works. And by the way, folks, this is a black and white issue. Okay, so here's the way it works. If you are still working, or your spouse is still working, and you're covered by that group plan, and there are 20 employees on the payroll or more, 20 or more is the key, then what happens in that scenario is your group plan always pays first, and if you enroll in Medicare, it will pay second. Okay, so in that instance, what I recommend people do, if you have a good group plan, then what I would do is I would only enroll into A only. Now, if you have an HSA attached to that group plan, I wouldn't do anything. Okay, I would just be on my group plan. But if you don't have an HSA and health savings account, it is fine to enroll into A only, and then Medicare is going to be in the second payer position. So if you do have a good group plan, we encourage people, don't enroll into B for sure, because you got to pay a premium for it, $185 at least a month, and you put Medicare in the second payer position. And so to me, that's a waste of money. Now, if you have a lousy group plan, I would enroll in A and B and get off the group plan. But the key to his question is 20 or more, Medicare pays second, group plan pays first. So if you have a group plan that you or your spouse are covered by, and there's 19 employees or less on the payroll, then it's different. Medicare goes in the first payer position, and your group plan is going to pay second. And if it's costing you a lot to be on the group plan, since you have to enroll in Medicare A and B anyways, what I would do is then I would drop the group plan at work, and I would pick up a supplemental plan or advantage plan, whatever is going to suit you best, because you're going to have to be enrolled in A and B if there's 19 or less on the payroll, so you have to pay at least $185 a month. All right, great question, Doug. Let's keep going. All right, Audrey, we have Plan G and are planning a trip out of the country this summer. We are covered with our Medicare supplemental plan insurance. If not, what would you suggest we do? Okay, so here's the way it works on Plan G. Plan F, Plan N would have this as well. But those plans are going to give you $50,000 worth of health care emergency benefits outside the U.S. And this is why this matters, folks, because outside the U.S., Medicare doesn't cover anything. You have to be in the 50 states or in the U.S. territories, Puerto Rico, Guam, the Virgin Islands, American Samoa, those places, to get Medicare to cover anything. But outside of the 50 states, U.S. territories, you have no coverage by Medicare. So what the Plan G and the Plan N will do, the Plan F as well, they include $50,000 worth of foreign travel emergency benefit. It's a lifetime benefit. It doesn't replenish itself. And so if you had a claim outside the country, what would happen is you would have to pay a deductible. Let's say you had a $20,000 claim. You would pay a deductible, $250 on that claim, and then they'll take the balance of that bill. I said $20,000 less $250, so we're at $19,750, and that Plan G or N or F will pay 80% of the claim, and you're going to pay 20%. But their 80% will stop at $50,000. I had a client a few years back that had a serious illness that happened to her on vacation in Ireland. She had a bill of $172,000, 4.5 weeks in the hospital, almost died. Something went bad with her liver. And so she did recover from that, but the bill was $172,000. And she was on a plan, but it only paid that $50,000. And again, it's not replenished. So she had a balance of $122,000. So the second part of the question, Marvin, what would you do? I would do what she did, and that is this. She bought travel health insurance. They're very reasonable, and she bought $100,000 worth of travel health insurance, and it paid. So Medicare paid nothing. Her plan paid $50,000. Her travel health insurance paid $100,000, and so she had a $22,000 bill, and that was it. Substantial, but nonetheless, she got that coverage. So I would recommend getting travel health insurance. Now, I would tell you this, folks, not all travel health insurance plans are the same. The company I've used American Express. I've used travel, it's called the travel health insurance. Man, I'm blanking on the name. Sorry about that. But you can find carriers that will provide this travel health insurance, and what I want you to pay attention to is the fine print. Because they're not all created equal. They're just different. And so read the policies, know what you're getting. I would also go with a company that's going to give you air evacuation coverage. The good policies will usually give you about $1 million of air evacuation, meaning you're somewhere where they can't treat you and they have to get you out of the area in a helicopter or a plane or something. That's very, very expensive, usually about $250,000 to $300,000 for air evacuation. But a good policy will include that. And so my point is read the fine print. It's really, really important to do that. Okay, so your plan covers some, but in case you're air vac, that $50,000 is not going to go very far. All right, let's keep going. All right, with type 2 diabetes, what are the rules to have a continuous glucose monitor to be covered? Well, first off, here's what I would do, Doug. Wherever you want to buy that equipment, then what I would do is I'd call that provider and ask them what the criteria are. I do know this, that of course you have to be diagnosed with diabetes, but you also are going to need to use a contracted durable medical equipment provider. Not all glucose monitors are going to be covered, but there are several that are. And so you want to make sure that you're going with a contracted provider where they're going to actually cover that. And so again, I know it's covered for sure. It's covered by Medicare Part B. It's 80/20. If you had a G plan or an N plan after you met your deductible, it would be fully covered. All right, so definitely covered by that, and then but talk to that provider or even ask your doctor who they would recommend you get that from, because it does have to be a Medicare contracted provider. All right, let's keep going. All right, I have Medicare and G and D plans, WellCare blocked a prescription Tier 4 muscle relaxant. Is this normal? Well, I will tell you that it is a possibility that they could decline it, but my question to you would be, was it a prior authorization medication? In other words, did you go through the necessary steps to try to get the prescription filled? If you did and they still declined it, what I would recommend is appealing that through what we call a formulary exception. So if it's not in your formulary, it's not going to be a covered medication unless the doctor says this is why we need it. Now keep this in mind. If they did block it, they could have blocked it because maybe it was an expensive brand name medication where they want to cover a generic medication. And so if you've never tried the generic medication, they may make you try that. We call that step therapy. You have to take the lower medication and then they step up and get the brand name after those lower cost meds did not work for you. So that's the process. First of all, go through prior authorization. Secondly, go through formulary exception. And if you still get denied, then you can appeal that. Okay, so that's what happens. And yes, they can do it, but normally we see if someone will be persistent, they'll eventually get that medication filled if you go through the right process. All right. And Daniel, would you do me a favor? Would you go get me those pads? I'm dying already. Yeah, if you don't mind. Sorry about that. I'll take this question. Then I'm standing right now because I like to do that versus sitting, just better for my back, but I need some pads to stand on. Okay, Patricia, I'm turning 70, getting ready to retire. I already have Part A and will be applying for Part B. I'll be applying for Kaiser Advantage. Thank you very, very much. Okay, I'll be applying for Kaiser Advantage as I have had Kaiser all of my adult life. What else do I need? Really nothing. Now, one thing about Patricia, applying for Part B, just remember you're going through the special enrollment period, and that means that your employer is going to have to complete an L564. An L564. Now, you'll need to initiate that. The employers don't have to do that. You can download an L564 form, and you need to give this to your HR department or whoever would fill that out, and you have to have credible coverage proving you've had coverage from 70 back to 65, meaning no gaps in coverage during this period of time, and the L564 is the form they'll actually complete. Then you'll fill out a form called 40B. It's a CMS 40B, and you'll tell them when you want to start your Medicare on the 40B form. So the L564 proves that you're eligible to come in using special enrollment, no penalties, no problems. You get that completed, submit that along with the 40B to your local Social Security office, and that will bring you into Medicare B with no problems. And then reach out to Kaiser if you want to be on that Advantage plan and let them know then that you're ready to enroll, because they're going to require enrollment into B before that enrollment's going to go through. In fact, what happens is once you have B, they'll submit the application for your Advantage plan. Medicare then will approve it, and then you'll go into effect on your requested effective date. So that's the process. So that's all you need to do. All right, let's keep going. Okay, Mark Holland, good evening. Marvin just received a Part B invoice for Medicare for 3 months totaling $945.60. Does that make any sense to you? Daniel, do me a favor. Take that $945.60 divided by 3. So it's what, $315.20? Okay, so here's what's going on. You actually have what's called an IRMA mark. So when you started your Medicare this year, 2025, and they look back at your taxes in 2023. They always look back 2 years. So in 2026, they're going to look back 2024. And so when they look back in 2023, what happened is, Daniel, that was what, 3? What was it? 3 how much?
315.
315. Okay. So you got, okay. All right. So if it's just for Part B, that premium, I don't know, it doesn't quite add up. It says it's for 3 months because there's nothing, because the Part B premium is $185, And if you took that times 3, that would be, 370 plus 185. So that's about, what's that, 4? How much is that?
185 times 3.
Times 3.
Yeah, that's 555.
555. Okay, so normally the difference there, which is in your examples about about $390, that additional amount should be an IRMA. But again, that's not showing up. What's the difference, Daniel? Hey, here's what I want you to do for me. Do me a favor. Take the 185 times 3, and then subtract it one more time. I want to see what that is. How much is that?
185 times 3 is 555.
And minus his bill, 945. What's the difference?
It's 390.
390. Okay, so let me tell you what I think that could be. 390. I don't know. The math doesn't add up. Here's what I do think, though. It could be, depending on where your income is, it could be 1 month worth of IRMA plus an IRMA for a drug plan. Again, even then, the math does not add up. So usually with that invoice, it says kind of at the bottom of the invoice the breakdown of that, because you should. Hey, Daniel, take 945 60 divided by 5. What's that? 189. Okay, because what I was thinking about was if you're not high income, Mark, then sometimes I have seen the first bills be as much as 5 months. The first bills could be as low as 2, could be 3, could be 4, could be 5 months. And so, Mark, if you're single, as they look back at 2023, if your income it was above 106,000 modified adjusted gross, or as a married couple, 212,000. If you're above those thresholds in 2023, then you're going to have an IRMA. That's that surcharge. So that's kind of what I thought was happening here.
You responded and said no IRMAs are listed.
No IRMAs. Okay, so that's probably a 5-month bill. 945.60 divided by 185. It's very close.
Mm-hmm. Yeah, it is close.
Yeah. I think that's what's happened, Mark. I know that when you're on a direct bill basis, you're expecting quarterly bills. But the first bill varies because when you enroll in the Medicare, it's kind of like the lottery system your first month. One enrollee gets a 2-month bill, next one gets a 3, next one gets a 4, next one gets a 5. So I just believe it's not quarterly. If you don't have an IRMA, then if you're below those thresholds, then that's what's happened. They billed you for 5 months of your Part D. Even though the math didn't turn out exactly like that, that's close. But listen, if you do have IRMAs, you're single above 106, married above 212, then what I have had happen, I've seen them bill you for maybe 3 months of Part B, and then only 1 month of a Part B IRMA and 1 month of a Part D. Because those first bills are always, they're just strange. That's all there is to it. But I encourage people to go ahead and pay that bill, especially if you have IRMAs, go ahead and pay it. And then the IRMAs will settle out by the time they build you the next time. Just sometimes takes a couple bills before the IRMAs actually add up. But again, if you don't have IRMAs, then I guarantee you it's more than a 3-month bill. Pay it, then after that, it will be done on a quarterly basis. And by the way, Mark, if you don't want to pay this bill, then you can actually go online and set up what's called Medicare Easy Pay, and you can pay your Part B premiums on a monthly basis through Medicare Easy Pay, or you can also have a mymedicare.gov account, and you can go online and pay that monthly, and you can even use a credit card to do that as well. Okay, so hopefully that helps you. We were trying to get the math to even out and just didn't do so precisely. All right, let's keep going. All right, can you purchase supplemental in if you are 67 years old? Absolutely. Now, here's the key, Spider Guy. If you are 67 and you just started your Medicare B, then if you're still within 6 months of that B date, then you can get that in plan with no underwriting. Okay, so if you've been on Medicare for a while and we've gone beyond the 6 months of our B date, then to get that in plan, you may have to medically qualify. But if you're new to Medicare, whether you're 65, 67, 72, doesn't matter, because if you just started your B date, you can get any Medicare plan that's available in your state and by any insurance company as well. So there's no underwriting during 6 months of the B date. All right, now you can apply 3 to 6 months prior to the B date beginning, but your supplemental plan will begin on the B date. And if you're already started your B date, you still have that 6 month window where there's no underwriting at all. After 6 months, there can be underwriting. Okay. All right. Hope that helps. Let's keep going. All right, are there different plans within G that one needs to decide on, and how does one do that? Okay, well, with the G plans, there are definitely, the healthcare coverage is the same. So a G is a G is a G is a G, no matter who you buy it from. So the carriers all provide the same coverage on a G plan. Everything's covered except the Medicare B deductible. And so the plan, Medicare pays, and the plan pays everything but your B deductible once a year. This year, that's $257. So here's my point. The coverage is the same. So whatever carrier you go with is going to pay the same bills, the same types of bills, and the same amount of bills. So there's no difference there at all. The only difference would be the carrier that you have selected, you're looking at two things. You're paying attention to what is my initial premium, and then secondly, you're looking at the carrier's stability of rates. How have they performed, are they stable in the last 10 years? Now, and some companies are more stable than others. Some companies tend to take price increases more drastically, more frequently. So what we do with our clients, and we're happy to do this with you, Diane, call in and we'll look at the carriers in your area and let's see who's been the most stable. Now, I don't have a crystal ball. I have no idea who's going to be the most stable in the next 10, 20 years, but I do know who's been the most stable in the last 10 years, and I think history will probably repeat itself. And so what we try to do is we like to go with carriers that are national. They're larger. They have a larger market share, because the larger market share that they have, there's more policyholders in your group, which means the risk is spread out to more policyholders, which in essence to you, the result is more stable rates. I'd much rather have a larger block of business I'm in than a smaller block, especially if that block has a lot of cancer going on in it. So that cancer is very expensive, and those costs are going to be spread out to either a few policyholders or more, and the more the merrier when it comes to that. So that's why we take the time not just to talk about what's your initial premium for the first year, but what do we think this is going to look like in 3 and 5 and 10 years down the road. They're all going to go up, but again, some go up more than others. So you need someone to show you how to compare the stability of the rates of the carriers. All right, let's keep going. All right, if we're on an Advantage plan and want to switch to a supplemental plan, what is involved with doing that? Okay, Cindy, well, it just depends on how long you've been on the Advantage plan and when you started it. So when people start an Advantage plan at 65, which means they went on Medicare A and B and they got an Advantage plan right at the time they started Medicare at 65, they're in what we call the trial right period, and that trial right period lasts for 12 months. And so if you started at 65, A and B with Advantage, and then you're on that Advantage plan now 12 months and a day, 13 months, 2 years, 5 years, 7 years, the only way to get off of that, unless you're in New York, Connecticut, Maine, or Massachusetts, okay, they have different rules. But everywhere else, what happens to get off the Advantage plan after that year, you're going to have to medically qualify to get a supplemental plan, all right? Now, let's say that you did not start your Advantage plan at 65. Maybe you enrolled in A only and you kept working, or your spouse did, and then you picked up B at a later date. Well, you don't have that 12 months. Day one, once you've had that Advantage plan, let's say I retire at 67, I take an Advantage plan, I want to get off of it. Now I'm going to have to medically qualify to get a supplemental plan. All right, and so the whole point is this. It just depends on how long you've been on that Advantage plan. And so this is a period of time that people don't realize. They sometimes jump on the Advantage plan opportunity, zero premium, they like the perks, they're healthy, and then and then they turn 70, and all of a sudden now they have problems. They want to get off of it and get higher quality insurance, which would be a Medicare supplemental plan, and now they can't do it because they have AFib or they have diabetes or whatever. And there's health issues that insurance companies do not have to accept. And for everyone watching tonight, that's what I want you to learn from this. When you first go on Medicare, you have that 6-month window where there's no underwriting involved whatsoever. You could be in the midst of cancer. You could be a type 1 diabetic that has retinopathy. You could have AFib. There's all kinds of health conditions that could be serious, but that 6 months of your B date, the insurance companies have to take you. That's called guaranteed issue. They cannot deny you. They have to cover your pre-existing conditions. They cannot charge you extra because of those conditions. You will absolutely get that policy. But after 6 months of the B date, now you've got a problem. Now you're going to have to medically qualify. So that's why it's so important to make sure you make that decision, not just short term. Hey, I'm healthy today at 65. You got to be thinking about 70 and 75, maybe 85, and not so healthy. How do you want your insurance to work? All right, let's keep going. Thanks, Cindy, for the question. Appreciate it. All righty, Terry, Plan D, Tier 3 drugs. Plan D, Tier 3 drugs. How can I get a discount? Can't afford the $2,000 a year. Okay, well, if you can't afford the $2,000, the first thing I would do would be I would apply for extra help. I'm not sure where your income is, Terry, but you can actually call a Social Security office and apply. You can call actually Medicaid, state Medicaid, and apply for the extra help program, because what that does is it'll help cover the Part D premium if you have one, and it'll also provide cost sharing where you don't even have to worry about the $2,000 max out of pocket at all. And so hopefully you can qualify for extra help. Now, if you, can't qualify for extra help, then what I would do is I would enroll into the prescription drug payment plan. At least then you can spread that $2,000 out throughout the year. Because that's what it's designed to do for people that cannot come up with the $2,000 initially. They can spread that out, and the sooner you enroll in that plan, the better, because then you have more months to be able to spread out the $2,000. The other thing you can do is if your state has a state pharmaceutical assistance program. Some states do. They're called SPAPs, State Pharmacy Assistance Program. If they have one of those, you may call your state, and sometimes they provide some assistance as well. So those would be your options. Okay, let's keep going. The VA considered a credible coverage option. If so, can a veteran postpone enrolling in a Part D plan without incurring any penalties? And the answer is yes. VA is considered credible coverage. So as long as you know you qualify to get your meds through the VA, you do not have to enroll into a Part D plan. You just get your meds, again, through the VA pharmacy. It's credible. So down the road, if you decided you want to go ahead and enroll in a Part D plan, maybe because VA changed their coverage or something, then all you have to do is prove that you did have credible coverage through the VA, and you can get into a Part D plan without any penalties. Now, you can only do that once a year. That's October 15th to December 7th. But again, there's no penalties at all because VA is credible coverage. By the way, those of you who are retired military, your TRICARE is also. It's credible. Those retired civil service, you have federal employee health benefits called FEHB. That's also credible. So employer plans, union plans, VA, TRICARE, and FEHB, all credible. All right, part one of two questions. Husband's working age 64. I'm not working age 65 in January. I'm on his employer health insurance, meets requirements. Employer sent letters saying if I'm not working, I must be. Okay, part two on part A and B, but I'm still getting their medical coverage. Will I be penalized per letter and get not Medicare? Okay, well, here's the thing. I'm assuming, Ren, that if this is a reputable employer, that it's a small employer, meaning you have there are 19 employees or less on the payroll, then yes, you have to go on A and B. You have to, okay? And then the group plan is going to be in the second payer position. So what I would do is I would find out what does it cost your husband to cover you on the employer-provided plan. And it could be that it may make more sense for you to come off that plan and to go ahead and pick up that supplemental plan so that you can qualify within that 6-month window of not having any underwriting at all. Let me go back to if you can, Daniel, to that question. Okay, make sure I'm covering it. So I'm on his employer plan. Now, I want you to know this. If his employer is 20 employees on the payroll or more, they cannot send you such a letter and tell you that you have to go on Medicare. That's actually illegal. Okay? So if that's what they're doing, then they're breaking the law. I'm telling you, 20 or more, you don't have to do anything with Medicare A or B at all. In fact, that employer could get in huge trouble for this. So again, I'm not saying they're breaking the law. I'm assuming they're 19 or less. So yes, if there's 19 or less, you're going on A and B. Then you have to decide if you keep the group plan, it's going to pay second to Medicare. And I'm just saying if it costs, let's say, $150 a month, $200 a month or more, then I would drop that plan and go ahead and just go to traditional Medicare. A and B pays first, get a supplemental plan and a drug plan. That would be, to me, a wonderful option. All right, hope that helps. Okay, is Part D permanent? No, Part D plans are only written for 1 year at a time. If they're embedded in the Advantage plans are only good for 1 year. If it's a standalone Part D plan, meaning you have a supplemental plan, you have a separate drug plan called standalone, then it's an annual plan. You can change those. Next year you may need more meds or less meds, and you can change those during the Medicare open enrollment period annually, October 15th to December 7th. So the plans are a calendar year, can be switched toward the end of the year for the coming year. All right. Okay, looks like we can switch Medigap Plan G to N, but not N to G, and with a different carrier during annual OEP without medical underwriting in Washington. Is that correct? Okay, very good. Actually, let me tell you the way it works. In Washington, you can actually do that any time of the year. The state of Washington is the only state in the country that has this particular right. I mean, it's annual, every single month. Most states limit it to your birthday months, maybe 30 days before your birthday, 60 days after. Those are called birthday rule states. But the state of Washington, it is anytime. Now you have to own a supplemental plan to be able to make that move, but you can do it at any time that you would like. And it is true, it is usually like or like to less, which would be G to G or G to N. Can't move from a less plan to a greater plan. But you're interpreting correctly, other than you just need to know it's not about the annual open enrollment period at all. It has nothing to do with it. Now you could do it then if you want to, because it's a year-round right that you have in Washington. You can do it right now. Okay, no limitation on when to do it. All right, let's keep going. All right, Susan, if I start Social Security now, 65, 3 months, rather than my full benefit, 66 and 10 months. So tells me you were born in 1959. The difference is $300 a month. Question 1, will my Social Security go up when I reach my full benefit? No. Now, once you've taken your own benefit at a reduction, it's reduced forever. Now, it can increase because of cost of living adjustments, but it's not going to go up when you reach your full retirement age. That's the whole point. You're taking early so you can have that cash flow. So they're not going to let you bump it up once you hit full retirement age at all. Okay, so it's a permanent reduction. Now, if I work part-time, will it go up? All right, so here's the way it works, folks. Every year after we reach age 62, after we reach age 62, our Social Security benefit, if we keep working, continues to be recalculated, whether I'm taking or not. Why? Because they're always going to take our top 35 years. So if you keep working, Susan, and you're making more money now than you did, say, 10 years ago or 20 years ago, whatever, that could kick out a lower earnings year and be replaced by a higher earnings year. So will it go up? Yes, as long as you are not taking. Okay? Now, let me rephrase that. It is possible then, if you go ahead and take now, that's your question. If you take now, keep on working, then the answer to that, I think, is yes. I am pretty sure that will benefit you by continuing to work, paying in Social Security, if you're replacing lower earnings years. Okay, and I'm sorry that I don't want to be dogmatic on that one, but I believe so. Sorry about that. You may need to call a local Social Security office to get confirmation. Dan, you know the answer to that question?
I don't.
Okay, I'm sorry. I have honestly, I've never experienced that before. And so, my bad. Let's keep going. Gary, I'm new to Plan G with supplemental insurance, have a $93 doctor bill, 93 plan exclusion, 0 apply to co-insurance, co-pay deductible. Okay, why? Here's why. Because if you're on a Plan G, this must be your first bill on that Plan G. Plan G pays everything 100% other than the Part B deductible. That's $257. So when that doctor submitted that bill to Medicare for $93, they're saying you have not met your deductible yet. So that 93 is now applied to the 257. And so your next bill, if it was another 93, again, now that's 186. So we're trying to get that 257 deductible paid off, and then after that you have 100% coverage. So that's why Medicare said we're not going to pay it because he hadn't met his deductible. Sends it back to the provider. They send the invoice for the full amount. That's the way the system's supposed to work. All right, our vision exams to monitor glaucoma due to diabetes diagnosis get covered under Part B, and the answer to that is yes. When you're a diabetic, type 1 or type 2, they're concerned about the diabetes damage to your eyes, so you qualify for 2 eye exams annually under your benefits with Medicare. I think it would be considered even a preventive type of service, so it's covered 100%. That's 2 of those a year. And so wherever you're going, they need to bill that and code that as preventive. Okay, 2 a year. Very good. Let's keep going. Okay, I know dental is not covered by Medicare, but I was wondering if you help with dental plans. We do. I need major dental work now and would like to know my options with dental plans. I live in Wisconsin. All right, so dental plans are certainly available in Wisconsin. Now, here's the way it works, Jeff. You can get a dental plan. However, If you've not had dental insurance in the past year or so, then what happens is you can get a dental plan, but you're going to have some exclusions for a period of time. Basic services are normally covered within 6 months. Major services are covered within 12 months. So even though you get a plan, doesn't mean that you're going to initially, right out of the gate, be covered for a whole lot. Some may cover you a little bit, but you'll have that better benefit after 6 months on basic and after 12 months on major services. Insurance companies are not stupid. You're not going to give them a $40 or $50 premium, then go in and try to get a $1,500 root canal or a cap or something. They're just not going to do that. And so you have to be aware, for anyone else watching, when you want a dental plan, if you just retired and stopped working, then that's the best time to buy them, because those waiting periods and those exclusions are not applicable. It's only when you don't have insurance that now you have to go through this waiting period. Okay. All right, can I switch from Medigap G, high deductible, to regular G without medical underwriting? No. That's in my opinion, one of the pitfalls of a high G plan. In order to get off of it, you're going to have to medically qualify to get to a regular G. Now, I do know there's some companies out there that they may write one for 2 or 3 years and say then during that 2 or 3 year window you can convert to a regular G plan without any underwriting. That's not the norm for sure, but I don't know exactly what high G you have, but I have heard of those kinds of plans. So the issue with high G is we get a lower premium, and you just simply have to meet that deductible. I think this year it's $2,900, something like that. And if your health changes, now you can't get off of that and go to a regular G plan. So for me, hey, I'll be 65 in January. I'm in this business, been in it 16 years. I'm not getting a high G plan, I can assure you that. I'm going to go with the G plan, may go with an N. I think both those are wonderful plans, great options. Most comprehensive, of course, is G. The next, still very good, would be the N plan. So I think those are the top 2 options. And there's a reason for that, folks. That's what about 95% of all Americans are getting today, would be the G or the N. Okay, Susan, so I'm not saying you made a bad choice getting a high G, but you do run the risk of needing to qualify when you want to switch down the road. And most people want to switch when they have health problems, then it's too late to do that. All right, thanks for the question. William, have you seen examples of not necessarily being turned down for a supplement, but where they allow it, but at a higher price? Okay, yes, yeah. There's one carrier in the country that actually would approve you, but they approve you at a higher rate. In fact, it's usually almost twice the amount. That's rare, meaning most companies don't do that. They look at your application, they're going to say yes or no. But there is one company that says, yes, we'll cover you, but you have some kind of health condition we're still concerned about, and we're going to charge you a higher rate. So I have seen that for sure. We don't write many of those. Most people don't want to pay that double premium, but I've done it a few times in my career. All right, let's keep going. How many alphabets are there in Medicare? Is there a chart to know what each one covers? Well, there's a couple different alphabets, actually. There's alphabets in original Medicare, A, B, C, and D. A is inpatient, B is outpatient, C is advantage plans, private health insurance company that replaces A and B, and D is for drug plans. So that's A, B, C, D. A is inpatient, B is outpatient, C is advantage, D will be your drug plans. And then you have some alphabets when it comes to Medicare supplemental plans. Different. A, B, C, D, F, G, K, L, M, and N. Okay, A, B, C, D. Unlike original Medicare, these are SUPs, A, B, C, D, F, G, K, L, M, and N. And of those 10 letters, the majority of people today are getting that G plan or that N plan. I think those are the best options. All right, hope that helps. Let's go. Okay, why does Medicare cover my medically necessary orthotics? My work insurance always paid. However, Medicare refused diabetes. Orthotics keeps me active and balanced. I know that. Yeah, I don't like that either. I've never heard of all the rules about orthotics, but I know that sometimes Medicare says these kinds of things, in their opinion, not medically necessary. And I know you would disagree, and I would disagree as well. But unfortunately, they set the rules. Same thing with dental. They just say not medically necessary. We're not going to cover that. So when Medicare started back in 1965, they laid out the list of how it was going to work, and they have changed that very little in these 60 years from then. So they just don't cover it. Sorry about that. Okay, Teresa, I was laid off in February. My husband and I are on COBRA until the end of August. My husband is 70 and has Medicare A and B. When she signed up for supplemental plan and prescription plan. Okay. Okay, so you're on COBRA. I wish I knew when your husband's B date is. Okay, so let me tell you. So Daniel, so he was born in 1955.
Sorry, I'm reading through other questions.
Okay, that's all right. So he's born in 55. I really need to know what his B date is. Okay, so you're on COBRA to the end of August. When should he sign up for supplement and prescription drug plan? Okay, what I would do, Teresa, if I was in this position, 55, if he's born in 55 and 65, so that means I think he has a B date of after 2020. And the reason I'm concerned about your situation is if he started Medicare prior to 1/1/2020, then he would be what we call guaranteed issue F plan. If he wants a G plan, he'd be guaranteed issue G plan if he started Medicare after 1/1/2020. So his B date matters. That's the whole point. So I don't know his B date. So if it's after 1/1/2020, he's guaranteed issue G. If he started Medicare before 1/1/2020, he's guaranteed issue F. And so what I would do is I would sign up ASAP for this reason. Because, well, of course, I don't know what your COBRA is costing you. So if COBRA is free, then I still have to know the B date. I just have to know the B date. So I would say, I don't know. Hey, Teresa, I got to know more about your husband's situation to really give you advice. There's a lot of moving parts to this scenario. So if you can go back in and let me know exactly what his A and B dates are, I can give you more advice. As a general rule, if I don't hear from you, what I would say is no more than 60 days of when he's going to lose that employer-provided plan. Then I would be enrolling into a supplemental plan and into a prescription drug plan for sure. Okay. Now I know your issue probably maybe COBRA is very, very inexpensive, but we don't want to keep that COBRA too long for him just because he has this period of time when he's going to be eligible to come onto a supplemental plan and a drug plan without any penalties. So that's normally a 63-day window. Okay. But let us know the dates and I may be able to help you a little bit more. Let's keep going, Daniel. All right, I'm receiving part-time prior to starting Medicare, physical therapy, sorry. Prior to starting Medicare, will Medicare automatically cover the days remaining of your therapy? Okay, so here's what happens. It's all based upon the service date. So if you were getting PT prior to, let's just say your Medicare date is for Part B, where it is covering your physical therapy, if that date was 4/1, you just started. So everything after 4/1 physical therapy will be covered by Medicare. And then anything that was prior to your beginning of Medicare would still be covered by the old group plan. So there's no pre-existing condition issues that you have to worry about. We move off a group plan onto Medicare. We'll just have someone else paying the bill. No longer group. It'll now be Medicare. All right. So date of service is what distinguishes everything. Anything prior to Medicare start dates, group plan pays. Afterwards, it's Medicare. Got to remind your bill, the provider too. Let them know you're now on Medicare, so they can stop billing the old insurance company and start billing Medicare and your supplemental plan. All right, Stephen, my local SSA office has been holding my IRMA appeal for 4 months. I've left many voice messages to Ms. Burke, but received no response. What is my next action to ask Ms. Burke to do her job? Yeah, that's a dilemma. Well, Stephen, what I probably would do if I were you is I would try to get another. I know you're reaching out to your local office, but expand it a little bit. I live in Kansas City, Missouri. Our office is in Kansas, but I live in Missouri, and so we have 3 offices in Kansas City on the Missouri side. So if I wasn't getting service from the closest one, then I'd go to the next one. So my point is, go out a little ways. Go to the next town, go to the next city, whatever you have to do, and reach out to them and call them. try to get that local number if you can, and go on hold, even if you have to wait a while. Now, by the way, national line, you're going to wait 2 hours. I wouldn't do that. But when you get a local office, and usually you can just put a local Social Security office in a Google map, and the local number will show up. It'll be a toll-free number, but it's still going to your local office. So I get hold of a local office outside the one you're contacting and say, hey, I've appealed my IRMA. I haven't heard anything back. Can you help me? And they may say, go ahead and send us the IRMA appeal paperwork, and we'll take care of it. Okay, so that's what I would do. And that's a real bummer. I will tell you this: once it is approved, they will backdate that IRMA. So you win your appeal, and if you paid the IRMAs, you will get a refund from them. Now, it may take a year to get it, so hopefully you can reach some other Social Security office that will be more responsible. But your situation is not uncommon at all. Okay, let's keep going. Okay, does the cost of a prescription drug count towards your Medicare deductible? No. Now, if it was a Medicare B covered drug, B, not D, drug, like insulin going through a pump, Prolia, something like that. If it's administered in an office, meaning professionally administered, then yes, that medication would go to the 257. But if it's a medication you're getting through your drug plan, the drug deductible this year is $590. Okay, so it's a separate deductible. So if you're talking about self-administered, the answer to your question is no, at all. It goes to that $590. All right. All right. How long after getting Medicare A and subsequently B should I wait to then apply for Social Security? Well, I think once your application has gone through, and they've acknowledged that it's gone through, even if you don't have your card, I think it's fine to go ahead and apply. Yeah, but I would make sure on your myssa.gov account that the Medicare has truly been approved. Now, you work with us, Robert. We have access to that system. We can tell you whether it has or has not been. But once it's fully approved, then going and applying for Social Security will not hold up that Medicare application. Okay? Yeah, it won't. Okay, keep going. I have Blue Cross Blue Shield, Federal Standard. I retired and will soon be 65 in November. Should I take Medicare supplemental plan? You know, Patricia, it really just depends on what the premium that you're paying for your Blue Cross Blue Shield is costing you. One of the negatives about taking a supplemental plan in your scenario is you actually would then terminate your FEHB benefits. You have to terminate it. To get a supplemental plan. So now if you're paying a lot of money, let's say you're paying $250, $300 a month for that Blue Cross Blue Shield plan, then I wouldn't mind terminating it. But if it's the premiums, a couple $100 a month or less, then I probably would not get a supplemental plan. I've had plenty of clients throughout my career that got off of FEHB. They were very unhappy with FEHB. They didn't want to be in, Blue Cross Blue Shield, Fed Blue, GEHA, those plans. They just didn't want to be a part of it, and they just got out. And then when you fill out the form, then they'll stop deducting the premium from your annuity check. But if you don't fill out the form, then you're not only paying for a supplemental plan, but you're also paying for your federal plan. So I wouldn't do that. So my point is, if you're comfortable getting rid of the Fed Blue plan and getting a supplemental plan, and if that makes sense financially, then that's fine. I'd be all right with that. I don't think that's a bad move. But if you're happy with Fed Blue and the premium is good, maybe family members are covered by it, I wouldn't do that. I would just have A and B and have Fed Blue in the second payer position. All right, Gina, if from South Carolina, turn 65 May, if I will leave my work and not getting Social Security benefits till my full retirement age, is that okay? Absolutely. Yeah, your Medicare decision and your Social Security decision are two totally different decisions. You can do them at the same time at 65 if you choose to, but if you're waiting to your full retirement age, which for you will be 67, then it's fine. Go ahead and start your Medicare. Now, the difference will be if you're not taking Social Security, and you're going to take Medicare only, then you're going to have to initiate that enrollment. People that are already on Social Security are automatically enrolled into Medicare. But if they're not on Social Security, you're not automatically enrolled. You have to self-enroll. So just make sure that you do that anytime 3 months prior. In fact, you can do it right now. So you can apply for Medicare right now for A and B. And Gina, if you want to use our company, we'll do that for you. We can look at supplemental plans for you, drug plans for you, advantage plans for you. So just call in and make an appointment with one of the agents here in our company, and we'll take care of that enrollment for you. Happy to do it. We do it all the time. So that way you don't have to worry about it. It'll be done properly and be done on time. All right, next. Okay, my PCP's office is in an outpatient facility that is associated with a hospital. Is it okay to sign a doc that says Medicare can bill me for both the physician and the outpatient facility? I'm in Plan G. Well, that's really, really interesting. Huh. Lenny, I've never had that before. So they want you to sign it. Okay, well, before I signed it, I would want to make sure that they're telling you that Medicare is still going to cover not only the doctor's visit, but also the facility fee. And if they're not going to cover it, I'd be getting a new doc. And hopefully you have other options.
It says okay that Medicare can bill for both sides.
Is it okay to sign a doc that says Medicare can bill me for both physician and the outpatient facility?
The only thing that matters in that is that they might be charged for their, or they might have to pay the deductible. Because if it's on the A side, then they wouldn't even have a deductible to pay if it's on the B side.
Yeah. Well, I don't have any experience with it. I'm sorry, Lenny. I don't. And you're saying it's okay to sign it. I've never had a client ever ask me this question before. I've never had anyone ever have to sign such a situation. I don't know. I mean, I'm skeptical. Okay, if they do this to other people and you're not going to get anything beyond, and that's what Daniel was saying. As long as you're not going to be billed any more than your B deductible, then that's fine. So that's what I would want to be assured of. Say, hey, I have a G plan, everything's covered by my B deductible, so I'm happy to pay the first $257, but after that, I never want to see a bill. And if they can promise you and assure you you'll never see a bill beyond the $257 annual deductible, then I'd be fine signing that. But if they can't give you that assurance, I'd be going elsewhere. All right. If I received a severance package that included my health care under COBRA, should I apply for Medicare during my SEP, or can I do it when my severance and benefits run out? I do not want the penalty. You cannot. Once you're on COBRA, you also must be on Medicare A and B. And the reason for that is because COBRA, once your employment is ended, it's going to move to the second payer position. So you have to enroll in A and B if you have COBRA. As soon as that active employment provided coverage ends, you want to enroll in Medicare A and B. If you keep COBRA, you can keep it for a while, but don't keep COBRA for your coverage more than 6 months of the B date, because after 6 months of the B date, now you're going to have to medically qualify to get a supplemental plan. Now, if you have a spouse or kids covered by COBRA, you can keep it for them, no problem. But you want to go ahead and go on that supplemental plan within 6 months of the B date. But again, on COBRA, you got to go on A and B right now. Okay, as soon as your employment ends, you've got to, because you got to get A and B in the first payer position. And if you don't, you're the first payer. Because I promise you, you have a big claim, and that COBRA provider knows you're Medicare eligible. They will not pay first; they will only pay second. Okay. Our brother will turn 65 May 8th. Can he sign up for Parts A and B and get a supplemental plan? He would take his Social Security early at that diminished amount if he's. Go back.
This is the continuation.
Oh, he's talking with one of your agents. Can they assist him in applying for Social Security early? Your fellow did that with me, but I rolled from. Yeah, no problem at all. Yeah, so can you go back to the question, the first one then? Okay, so we will help you. If anyone wants to start their Medicare A and B and Social Security at the same time, we will assist with that. We can tie those two applications together. And he's turning 65 in May, so he can start his Social Security in May, get his first check in June. And he can, of course, begin his Medicare A and B May 1st. So this is the time to do that. Yeah, just call in, and our agents can help you with that for sure. Tie it all together. Very simple to do. Okay. What is the free money cards that's being given out? Is this an advantage trap? Yes. Now, here's the thing. I would definitely call it an advantage trap because not all plans are going to have those free money cards. The ones that are really, it's the real thing is people that are qualified for Medicare and Medicaid. That's called the dual eligible. And they do have some free money cards attached with all of those for sure. There may be a few that are non-Medicaid plans, and so what I'd want to find out, if they're going to give you something for free, then you want to find out, well, and what are they taking from me? So if it's Medicaid and Medicare, that's legit. If it's just Medicare only and we're talking free cards, then I'd want to know what my specialist copay is, my max out of pocket, what's going to cost me to go to the hospital. You want to look at it, because when companies start giving you something free, unless it's Medicaid, of course, then there's something that they're taking that money from that plan in some fashion. Higher copays, co-insurance, there's a lot of things that can happen. So it's definitely a trap unless it's a Medicaid plan. All right. Okay, I turned 65 in October. I still work. I have good insurance. What do you recommend? Well, Linda, if you have good insurance at a good price and there are 20 employees on the payroll or more, you don't have to do A and you don't have to do B. Now, it is fine to do A only as long as you don't have an HSA. If you have an HSA, don't do A, don't do B. If you have an HSA, don't do A or B. If you don't have an HSA, then I would do A only. Keep the good group plan, and if it's, as long as the price is $250 a month or less, then that's a good option. If it's more, then I would look at Medicare as probably a better option. All right, but you're telling me it's a good plan, good price, you have to do nothing at all. And you won't be penalized either, I promise. But if you don't have an HSA, do get Medicare A only. I think that's fine. Your group plan pays first, A pays second. But A may pay something. They pay co-insurance on hospitalization. All right, let's keep going. Brent, if someone starts Part B while working and on an employer plan, will they forfeit the opportunity to get a supplemental plan without underwriting if they stop working more than 6 months after the B date? No, they would not. What happens is this. In every state in the country, we have what's called a guaranteed issue right. And that means that if you do have A and B and you keep working, then what will happen is when you leave that work, there's always one guaranteed issue product you can go to. Right now, for most people, they're born after 1/1/1955, that plan would be a G plan. You couldn't get an in-plan guaranteed issue, couldn't get something else guaranteed issue, but you could get a G plan. So you do have a place to go. But what I would say, Brent, is why would you, if you have a good group plan, why would you enroll in A and B? To me, that's a waste of $185. Maybe there's a reason, I don't know. But if you have a good group plan, I would just enroll in A only and then pick up B at a later date, and that way you can get not only a G plan, you can also get an in plan if you decide that's what you want. But you could, if you get A and B now, you do have a place to go. But it's G only because it's a guaranteed issue. Now, you could get an in plan if you went through underwriting, but you may not be able to pass that. So the whole point is be sure you're making the right decision by going on A and B if you have a group plan. And you may be. If it's a lousy group plan, then if you're paying anything for it, I'd come off of it and go ahead and get A and B in a supplemental plan, take care of it all at 65. Hope that helped. A lot of scenarios there, Brent. I just don't know enough to tell you exactly what I would do, but that's some input. Let's keep going.
You had just answered her question. She was asking what you meant by HSA.
Okay, yeah. Health savings accounts, they're wonderful. Set aside money that's pre-tax to use for qualified medical expenses. So it's money we set aside. It's usually payroll deducted. Sometimes employer also puts money in. And we can put money into an HSA as long as we're not in any form of Medicare. Can't have A, can't have B. If you do have A and B, you can no longer put new money into your HSA. So it's a tax advantage way for people to save money for present and future healthcare expenses. Pre-tax and then post-tax if it goes to medical expenses. Never taxed. All right, to switch from Plan G to N, do you need to go through underwriting? In most states, yes, you do. You do. There are some states that you don't. Those states are called birthday rule states. You can go from a G to an N around your birthday. Some states are 30 days before, 30 days after, some are 60 days after, but we have about a dozen birthday states. They are California, Oregon, Washington, Idaho, Nevada, Oklahoma, Missouri, it's same, but it's called Anniversary. Illinois, Louisiana, Kentucky, Maryland. I just saw where Virginia just went guaranteed issue birthday rule. I think it goes into effect, I'm pretty sure, 1/1/2026. So, like I said, about a dozen different states where you can move G to N. So the rules are, if you're in a birthday rule state, it's like to like or like to less. So G to G or G to N. Okay, and sometimes you can change carriers. Louisiana and Illinois, you can't. You have to stay with the same company. Illinois says only through the ages of 65 to 75. All right, so again, it varies. Call in. We can help you with that if you'd like. All right, true to the word. What is the best way to evaluate a Part D plan? I've checked my scripts, and there is a zero-cost plan that covers them all, but I want to be sure they don't change formularies or have other issues. Well, they rarely change formularies in the middle of the year. There are times when FDA may drop a drug, they drop it from the formulary, but usually the formulary, they're pretty consistent with that throughout the year. So what I would do, if you have a zero premium plan, which is that WellCare value script, I'm assuming, Blue Cross has some as well, that's zero premium, then if it works for you for this year, that's what I would enroll in if it were me. And then later this year, October 15th to December 7th, if your meds have changed, then you can always switch and change drug plans for January 1 the next year. All right, but I just don't see a lot of formulary changes throughout the year. The plans are they've been approved by Medicare, so they try to be pretty consistent with those plans, and then they change them for the following year if they're going to make any changes. Okay. All right, Ron, I'm in New York, over 65, just lost my job. Can I go on my wife's group plan and then get B with supplement with no underwriting at a later date? Yes, you can. Here's the deal, Ron. This is really important. You're over 65, just lost your job. You want to be sure that you have no gaps in coverage. So as long as you just lost your job, you go on your wife's plan, as long as there's 20 or more employees on your wife's employer payroll, 20 or more is the key, then you can do that, and you want to do that ASAP, okay? You do, because in order to qualify down the road, which we call an SCP enrollment, you can have no gaps in active employment. It can be yours or it can be your spouse's, but there can be no months missing at all the way back to 65. No months. So if you just lost it and they're going to cover you through the end of April, then you get on your wife's plan effective May 1. Okay? Yeah, because you can have no gaps in coverage. That's the key, and it will work for you. And you can pick up B at a later date, and you can get a supplemental plan tied to your B date as well. Okay? All right. What was the name of the program that you can spread out your... It's called the Medicare Prescription Payment Plan. Medicare Prescription Payment Plan. And wherever you get your Part D plan, they will be the ones that actually will enroll you into that plan. Okay, every insurance company that offers D plans will make that available for you. Okay. All right. Are dental vision plans worth having if you're on a supplemental plan, just paying out of pocket? Well, I think people that have dental concerns because of unhealthy teeth and they're going to use the plan, I think dental plans are worth it. Now, if you're saying to me that your teeth are in great shape, frankly, I have a plan and I hardly never use it. My teeth are great. I floss all yada yada. But so it just depends on the health of your teeth right now. If you're concerned about it, then I definitely think dental plans are worth the money. Okay, so vision plans. Now, with original Medicare and the supplemental plan, you have great vision coverage already because Medicare covers everything except for eyewear and exams for eyewear. They cover cataract surgery, glaucoma, macular degeneration. I mean, they cover all kinds of diseases of the eye, and the only thing they don't cover is eye exams or eyewear. And so when people get a vision plan, what they're normally buying is a plan that costs $15-20 a month that will then give them one eye exam a year and then a discount on eyewear. So again, the premiums are pretty low, but I wouldn't. I'm not going to get a vision plan. I already have a dental plan, just don't use it. But we find that about half of our clients get dental plans, half don't. So it really depends on the health of your teeth. Okay. let's keep going. TWILD, where can I find the cost of a Medigap plan, supplemental plans year in Colorado? I understand Colorado is a special state and Medicare costs are assessed differently. Can you please explain? Okay, well, Colorado is a state where they may have a variety of ways in which the rates are applied. We have community rated, issue age, and attained age. That'd be the only way that I'd say Colorado special. Sometimes states will dictate how insurance companies must establish the rates. Again, there's three methods of pricing. And so the best way to do it, call us. I mean, we write all kinds of business in Colorado, and we can tell you the different carriers and the way they've established their rates, whether that's community, issue age, or attained age, and give you the ins and outs of not only the initial premium from the carriers, but also the rate stability of those carriers. And if you don't want to call, just go to this website. Daniel just put it up. This is a company that we're a part of, medigapcompare.com. medigapcompare.com. And you can go in there and give them your birth date, your zip code, and you can see all those rates from several of the carriers. Now, I'm not going to tell you every carrier's in there. There are a lot of them that are. But if you call our office, then we can give you almost every carrier's rates in the state of Colorado. Okay, but this website's good as well. Give you a good starting point. All right, let's keep going. Any more questions? All right, Tammy, I'm Medicare A and B. Even I carry FEHB after retirement. What's your opinion if I drop FEHB and enroll in a supplemental plan Energy because I pay $6? Oh, wow. Yeah, well, you're paying too much. So if it were me, Tommy, I would, of course, does that 609 include your family? So that we kind of bring that into the equation. But that's a lot of money for premium. So I'm not sure where you live, but you can get a G plan right now on average, turning 65, about $150 a month, okay? Now, there are some states that are more, for sure. In plans on average, most states about $110, $115 a month. And so you already have A and B, so if you're paying that much money, that's a lot. Now, if your spouse or children or whatever are covered by that plan, then that's a whole different story, unless they have somewhere else to get insurance, because if you terminate FEHB, you fill out the form to send to OPM to drop that premium from your annuity, then that your spouse and children, if they're covered, are also going to lose their coverage. And so if you have a place for them to go, that's fine, no problem. So I just think that's a lot of money, 609. Would not do that in my life. Okay, let's keep going. How much does it cost to have you enroll for us? So cuisine with Pauline, nothing. Yeah, all of our services, and know this, listen, any agent you use, folks, this is not unique to our company. Any agent you use is paid by the insurance company, not by you. We're brokers. That means we just write for multiple carriers, but every policy we write, insurance company pays us commission. Plus, there's no extra money. Let's say if you call the insurance company direct and they said that G plan's $150 a month. You called us, it's $150 a month. There's no difference in price. No matter who you go, the premium is established by the insurance company. It's always the same, all right? And so, but the agent's work is always paid by the insurance company, not by you. And just so you know, folks, this is the same way with auto policies, homeowners policies. They all have to be written by agents, and you don't pay the agent. That's just built in the cost of doing business by insurance companies. They have to comp the agent that wrote the business, all right? Whether it's health or life or home or auto or whatever, we are paid by the insurance companies. All right, let's keep going. So we're for free. Call us, Cuisine with Pauline. We'll help you, and you'll be happy with the service too. All right, do either supplemental or TRICARE for life pay the annual Medicare Part B deductible? There is a plan that pays the Part B deductible. That's Plan F. But that Plan F is only eligible for people that started Medicare prior to 1/1/2020, which means they probably were born before 1/1/55. So the F pays it, but none of the others do. And what happens with TRICARE? TRICARE has a max out of pocket of $3,000 for the whole year, and so I believe on a TRICARE claim, I think you're going to also have to pay that deductible as well. I know TRICARE has max out of pocket $3,000, and TRICARE is good insurance, but you still have max out of pocket $3,000. So what a lot of people on TRICARE do is they enroll in A and B and get TRICARE and then get a zero premium Advantage plan called MA only. And so TRICARE will coordinate with the MA only plan, and then you get your drugs through TRICARE. And then the benefit of that to you is if you have an MA only plan, getting drugs through TRICARE, your medical through your Advantage and TRICARE, then you get a fairly sizable deduction on your Part B premium. Sometimes it's the whole amount. They'll give you a credit of $150, $175 every single month to offset your Part B premium. That's called an MA only plan, Medicare Advantage only. No drug coverage because you get that through TRICARE. And we have a lot of veterans, a lot of retired military people do that. Call us and we can talk to you about the MA only plans. All right, Daniel. Okay, what happens if you're on a give back plan and you get IRMA flagged? Okay, well, it's all right because your give back is money that's coming back because that plan kind of baked that into its coverage. That's who's making the give back possible is the Advantage company. So I don't think there's going to be any issue at all that you have a give back and an IRMA. Okay, yeah, it just means that your bill could be less, of course, because that give back, but that give back is probably just going to offset your Part B premium. You'll still get your IRMAs, but there's no problem whatsoever. If you're on Social Security and you have a give back, what's happening is your Social Security check goes up. If you're not on Social Security and you have a give back, then your direct bill goes down. Either way, you're profiting, and it should be not a problem whatsoever. Okay, hi Marvin. Team, you guys got my wife and I on A&B. Will Medicare take care of us when we go on Mediterranean cruise in May, June? You know, Kevin, I don't think so. My understanding is that you're covered for so many miles outside of the U.S., off land. And I'm not sure how many miles that is. Daniel, can you Google something like that? I just don't know, but I
number of miles.
Miles. I think it's once you're offshore so many miles, then I don't think you have any Medicare coverage at all. Now your supplemental plan is going to cover you up to $50,000 for sure, but
it's more than 6 hours away from the U.S. port.
Okay. Daniel just Googled and said if you're more than 6 hours away from the U.S. port, then your Medicare is not going to cover. Supplemental plan will cover again that $50,000, but that's it. All right. So I would look at some travel health insurance. I blanked on the name of that earlier. Travel Insurance Center, it's called. Travel Insurance Center. Let me just give you that number real quickly. I've used them before. I think they're brokers, so they offer a lot of options. So let me give that to you. Travel Insurance Center. I like them as brokers because then they'll shop it based upon where you're going. But here's the number. It's 866-979-6753. 866-979-6753. Travel Insurance Center. I went to Israel a couple years ago, and I used American Express. It was really good. They didn't risk up the trip with the premium. Travel Insurance Center, they're brokers. That's who I almost always use. But with Israel, American Express had the best deal. All right, and remember, pay attention to the fine print. Make sure you got air evacuation on there if something they had to get off that boat. Okay, thanks, Marvin. I love you guys. You're amazing. You're true teachers, and you have a heart of service. Well, Flo, thank you for the encouragement. We love doing what we do. We love to help people, and it pays the bills at the same time, and so it's win-win. So thank you for the encouragement. All right, is there a cost to having a conversation picking a Medigap plan, G-Care? No, not at all. No. There's no cost at all to talk with us, and as I was saying just a few minutes ago, it doesn't cost you to have any relationship with an agent. The agents, us, all of them, are paid by the insurance companies, not by you. The difference is what service will they provide. One of the neat things about our company is we're large enough, we have our own customer service department. So when our clients have a problem, they don't have to, call the 800 number on the back of their insurance card and end up offshore in the Philippines or India or China or someplace. You call us, and as your broker, we can help you, and we do all day long. I've got a huge customer service team of people that are here just to assist our clients with problems that they have. And again, there's no cost to you whatsoever. Thanks for the question, Susan. Daniel, let's keep going. All righty, Phil, which Part D plan best covers the diabetic drug? Oh, you know what? Here's what I would do. What you want to do, go to Medicare.gov and say you're looking for a drug plan, put your zip code in, and put that medication in, Medicare.gov. They'll show you all the plans. Now, for our clients, we help with this service. We have our own tool that we use. But just to answer your question, I would go to Medicare.gov because all the plans in your zip code will be available. And just put that one medication in. You'll be able to do it. And it'll shop them and show you what's the best option for you. Okay. What else? All right. If you've laid off for a couple of months, is that considered a gap? Absolutely. Yeah. If you're laid off and you are on COBRA, that is a gap. Now, folks, listen. If you have a gap prior to 65, it doesn't matter, okay? You could be uninsured. It doesn't matter. What matters is if you are working at 65 and then you plan to keep working and then you lose your job, then you need to go on Medicare immediately, okay? Or go on your spouse's employer-provided plan that has 20 or more people on it. That's when we're concerned about the gaps, only after 65. Prior to 65 does not matter at all. I promise you it doesn't. After 65 does, because we're going to try to come into Medicare using what's called the special enrollment period. And the only way to have credible coverage after 65, it has to be an employer-provided plan, active. It can be your employer plan, your spouse's, doesn't matter. But it can't be COBRA. It's got to be active after 65. All right. Good evening. If I start my Medicare in North Carolina with supplemental plan and then move to South Carolina, will I have to change my provider and go through medical? No. Great question, Curtis. All supplemental plans in every single state, certainly North Carolina to South Carolina, those plans are guaranteed, renewable for life, can never be canceled by the insurance company except for non-payment of premium. It's one of the beauties of supplemental plans. They're permanent. Once you have the plan, it's yours. They can never cancel because of how old you are, can't cancel because of claims, they can't cancel because of age, nothing. Pay the premium, you got the plan. And once you move from North Carolina to South Carolina, that carrier can re-rate you. They can move you up if it's higher there or move you down if it's lower there. Okay, that's the way it works. Now, again, between those two states, there's going to be very little difference. But the carrier does have the right. They have to cover you, but they do have the right to re-rate you if where you're moving to has different rates. I've seen them go up. I've seen them go down. All right. Anybody else, Daniel? All right. What are the benefits of both husband and wife having sub-plans from the same company, but what if one spouse has a G and the other plan N? Okay. Doesn't matter the plan type. If one has a G, one has an N, you'll still get what we refer to as a household discount and a multi-policy discount. Household discount means you both are above 50. Multi-policy means you're both with the same carrier. You can have different plans, G and N, doesn't matter, you'll still get a household. And those sometimes are as much as 20%. We love those. So that's the benefit. So I would definitely do that. Be on the same carrier. Don't have to be on the same plan. All righty. Audrey, is cancer treatment, chemo, radiology pills, etc., covered under medical or prescription drug plan? Sorry, new to this and don't quite understand all the parts of cancer treatment. Okay, first off, chemotherapy and radiology is definitely covered under Medicare Part B. Now, here's the way it works for chemotherapy pills. If you're taking a pill that has a chemotherapy equivalent, meaning if you were taking true chemotherapy, I forgot what they call that, but anyway, so if you're going to a facility, you're taking chemotherapy, if there is a pill that is equivalent to that, my understanding is that would still be covered by Medicare B. And that's what you want, by the way. Medicare B, once you've met your deductible, if you have a G plan, 100% coverage. All right. Now, if there is not a chemotherapy equivalent and it's some type of a chemo pill, then that is normally covered by drug plans. And those are expensive, but the good news is, regardless of how expensive they are, if they're covered by your Part D plan, then your max out of pocket's $2,000 for the whole year. All right? So A is inpatient, that covers your cancer surgery. B is outpatient, that's going to cover your chemotherapy, your visits to the doctor, surgery, the surgeon, all that kind of stuff, anesthesiologist. But your drug plan for medication that does not have a chemotherapy equivalent. All right. Hope that helps. Let's keep going.
at 6:30.
Okay, folks, my back is killing me at 6:30. I love doing this. I wish I was younger. I'd go longer, but I'm dying. Just have a bad back. So we'll do this again next Thursday, 5 o'clock. If you have any other questions, please just call us. All the agents that work here, I've trained. I started this company back in 2009. And so been at it a long time, and we've got agents that have my passion for education, that understand this whole system that I just explained to you as well. So we'd be delighted to help. Just give us a call, and we'll take those questions for you there, and then help you with any other issues that you have, Social Security or Medicare, either one. Thanks so much for watching. Have a great evening. Appreciate it.